Hi, everybody. This is Alan Hollander. Delighted to have you on our podcast, Inside the Practice, where we try to keep you informed on innovative and interesting things going on in the world of dentistry. We have a wonderful guest I am delighted to have with us. He is a highly respected and accomplished oral and maxillofacial surgeon with dual training in not only OMS, but general cosmetic surgery as well. He is a quadruple board certified by the American Board of Oral and Maxillofacial Surgeons, the Board of Facial Cosmetic Surgeons, the American Board of General Cosmetic Surgery, as well as the Royal College of Dentists of Canada. He got his MD degree from Case Western and his DMD from Oregon Health and Sciences University, where I will add he did graduate at the top of his class. So, and he is a longtime client of our consulting firm, ePractice Manager, for total transparency here. Hardeep, it's wonderful to have you. This is Hardeep Dhaliwal, and we're going to talk today about just some of the more interesting aspects of what he does in his very interesting journey and career. So welcome, Hardeep.
Thank you, Alan. Appreciate it.
Great to have you here. You know, I guess the first question I would like to ask, if you consider the extensive training you have, I mean, my gosh, we work with many oral surgeons, some of whom are double degree. There are few, however, who have put in the time to develop your credentials. I'm just interested in what inspired you and moved you to pursue, I guess, really both cosmetic and oral and maxillofacial surgery.
Good question. I think it's the people I got exposed to really than my interests. I always like doing more. And then as I meet people, they'll introduce me to that more. And then it just, they pull you forward. So I feel like my future self is pulling myself forward. My mentors are pulling me forward. So really just the right circumstance, the right position, meeting the right people. I never thought I would actually do cosmetic surgery at all. If anything, I thought I was maybe taboo or the wrong thing for an oral surgeon to do. And then I just met a lot of people and realized that oral and maxillofacial surgeons are probably some of the best people as far as skill set to do that, because we are trained in aesthetics on a micro scale and on a macro scale. Our surgical skills are in a micro and a macro scale. We can not only fix soft tissue, but bony stuff. We can reconstruct things. Because one of my mentors took me to the cosmetic surgery meeting. I went there and I saw how prominent the oral and maxillofacial surgeons were in this group and how big of an impact they could have. And it just pulled me forward.
Yeah, that's very interesting. Yeah, I guess even from a lay point of view, it makes sense actually. Doing facial surgery and cosmetic facial surgery for an oral surgeon, the depth of understanding that one would have sounds like would be rather expensive.
Yeah, I would agree.
Yeah, good.
But again, I don't think it's the specialty that's important. It's really the experience. So like, if we're getting into the cosmetic surgery, who's better? I don't think a particular specialty is better. It's just whoever. It's really your surgeon specific. So certain surgeons, certain experiences, volume, and all that speaks volumes. So I think lots of specialties are well versed at doing this type of thing.
Yeah. Yes, understood. Yeah, very interesting. So this path was inspired by various mentors. Anything in particular? Any particular highlights that where you went, oh yes, I should do this. Any particular experiences or episodes that might be interesting to listeners?
You know, in residency, we had quite a bit of cosmetic surgery in the residency. So facial cosmetic, I find, is always in the realm of the oral surgeon's practice for sure. Body, I wasn't sure early on, but after I went to the American Academy of Cosmetic Surgery general meeting, um, seeing these oral surgeons doing complex revisions for other specialties and fixing problems that no one else could fix, I realized that, hey, like anybody can really do this. It just depends on your experience. Mentors in our residency were definitely very, very prominent in pushing that forward and not making sure that we feel limited. And then I spent 2 months in Belgium where it was very much cosmetic surgery focused. So you just those mentors, seeing how comfortable they were, and then most of them were fixing just revisions. They were doing revisions for other people, and some of them had multiple revisions and no one could fix it. And so when you see that someone so close to you can fix something in such a bad state, it makes you more confident as well.
Yeah, fascinating. What were you how did you, end up in Belgium?
So our chairman, Dr. Dale Bauer, had a relationship with a Dr. Luc Sestelin, and everybody during the third year has the opportunity to go abroad. The challenges like family and not being present, not being in your residency just becomes difficult.
Yeah.
I thought it was an opportunity. I had emailed with him. He was really supportive, said I could stay in his office. Um, I'm not much of a tourist, so I didn't really want to just do the tourism thing. I just wanted to do surgery. And he seemed on par with that, especially when I got there, because he was trying to push me to do tourism. I was like, I am not, I don't enjoy doing vacation on my own or going to look at scenic things on myself. I just enjoy people and learning about surgery. Vacation, I'd want to do it with somebody. So I just spent with him, I don't know, probably 16 hours a day in surgery, 7 days a week. Wow. It was just an amazing experience. And it's really, he let me come because of Dr. Bauer, because he knew Dr. Bauer so well.
Mm.
So I was,
Yes, not hard to understand, Dr. Dhaliwal, why you excel at what you do. This is yeah, really interesting. These are things about you I was mostly unaware of. Of course, I do know I know what you do in your practice, but these all the details seem interesting. Sarah Boylan, of course, is with us. Hello, Sarah.
Hi, on.
And Sarah has been an office manager in dental for many years, very experienced. She's with our company now, and thankfully. And Sarah, I know that you had a few questions you wanted to ask Dr. Dhaliwal.
Dr. Dhaliwal, it's been a few years. It's great to see you again. I am chomping at the bit to ask what your daily schedule is like. And I know our audience and listeners are going to want to know about this too. So, on your schedule, I mean, does it look like we're removing thirds and then doing a facelift next, like in the same procedure, or what does your flow look like for that?
yeah, it's interesting. When we first started, definitely the staff wanted things more separated on different days, just as far as structure. But now we just mix it all together. My longer cases I like to do towards the end in case they take longer, but everything just mixes in between. And I just run from room to room to room. It's
Mm.
been pretty well oiled. The only difficult part is longer surgeries take longer to recover. So we have to make sure that we have an extra recovery time for that. But generally, we just mix everything together. There's not really a restriction, but it used to be that way. And I think most surgeons when they start run that way. But our team is so good that they could shift gears really quickly as far as the surgery, the equipment, the post op. Our team is probably one of the best teams we've ever had. Actually, not probably is the best team we've ever had. They're just well oiled. No one has much discomfort on doing any procedure or jumping in and helping me.
That's amazing. Like your setups. I imagine, you have different procedural instruments for each setup. Like, so you just map it all out, like we're going to do this in the start and this in the middle and then this in the end. And then what are the different procedures that you do?
Yeah, so we stopped body surgery after 2021, I think, or 2020. That was coming out of COVID, just elective surgery versus non-elective and how we were restricted. So, and then when we came out of COVID, we got really busy, maybe like 2 or 3x what we were, and we couldn't fit people in the schedule. And then e-practice helped with this. And then one of our TCs in our office was like, you need to restrict what you do to what you like. And not that I don't like body, but I definitely enjoy facial surgery more, and I really enjoy bony surgery. So we've definitely now probably our main things that we do would be we do a ton of dental implants, a ton of orthodontic surgery, uh, facial cosmetic surgery, and wisdom teeth. Though I don't do any body surgery, and I think in 2022 we cut out rhinoplasty as well. But that's essentially it. But I'd say our fastest growing is probably implants and orthodontic surgery is actually probably what's growing the fastest, and that's probably because I just like bony surgery.
Nice. So can you tell me any new notable innovations that you're really currently focused on? I mean, it sounds like you're kind of touching on that a little bit. Can you elaborate more?
Yeah, I think in our practice, I think we're kind of at the forefront of most of the technology, and we've always been there. So, like in regards to orthodontic or implant surgery, we have navigation, we have you know guided surgery, and we have everything that's done in digital technology. So everything that we can do digitally is done digitally, and probably more so than most offices. We make a lot of the guides in office, and some people make guides in office for cost savings. We don't do it for that reason. We do it because I like to be right close to the planning. um, if the planning is done by a planner and you're not involved, sometimes you can miss something. So I love to plan a case and come back 3 days later and revisit it. So we are at the forefront of that. We have multiple 3D printers in the office, multiple scanners. So we're just doing a lot of stuff in office. um, I think the other part is maybe like I'd say that we're trying to do more of is more minimally invasive surgery. So doing things with smaller incisions, uh, less dissection, particularly in orthodontic surgery. So our incision for orthodontic surgery is pretty small. Maybe about this big for an upper jaw and each cheek. It's still unclear if that really makes a huge difference in outcome wise. Anecdotally, to me, it seems like they swell less. Their smile returns to normal quicker. But other than that, I don't see a lot. I think in the future is probably things are going to be coming out more, um, less navigation and maybe more robotic assisted surgery and more AI involvement in the planning of all that, um,
Yeah.
which may or may not help. Just depends, probably for the specific surgeon. So if you're a surgeon who needs more of that, maybe it'd help you. Or if you're one who wants to be able to have more control, and we're kind of right in the middle where we plan our surgeries, but our guides are fabricated in such a way that I can modify the surgery so I'm not locked into what the plan was before surgery in case the bone is soft or there's some change in plan.
I have a question. I'm interested because your surgical assistants, Dr. Dhaliwal, uh, do you have uh, do you have a group of assistants who work with you on the cosmetic side? I mean, I know you have a wonderful surgical suite and facility there, but do you have assistants who work exclusively on the cosmetic surgery as opposed to the oral and maxillofacial, or are they just trained to do it all?
We try to train everybody to do everything. So if they
Mm.
when they start, some of them will have trepidation of jumping into certain things, or maybe I would say I have trepidation, but we're going to push them along. So if we have a team member who's really good and one who is less confident, or I feel like their skill set's not as fast, we just pair them up until they get to the same speed, because it just everybody needs to be the same speed, skills. Obviously, there's
Mm.
leaders and coordinators that can help along with that, but we try to get everybody to the same speed. But it may take a year, right? So it may take someone who comes in and hasn't done a lot, and it might take them a year or two, but we generally just keep pushing them along, pushing them along, pushing them along. Um, so yeah, ideally everybody does everything. I haven't, I don't think in the current team set that we have anybody self-restricting themselves from doing certain things. Um, we can usually train everybody. The team is so good.
Yeah, that's very, very well. I'm aware of that. I am definitely because of our relationship and your relationship with the company. I know that your team is very important to you, and a lot has gone into building that team. I'm very happy to hear all of this.
Yeah. So I wanted to jump into another topic about mentorship and continuing education. I mean, obviously, you're a leader in your industry, and my understanding is you've put together a study club for other dentists in your area. Can you tell me a little bit about your purpose and your vision behind your study club, and what is the um, how it's helping to push the envelope a little bit for your
Yeah,
students?
I don't know if it's pushing the envelope more so that just like I find the dentists in the community sometimes there's stress in asking a question because you think it's simple, or you feel like if something seems so simple, maybe you feel like okay, you're inadequate. So we try to make it like very open that like something as simple as how do you numb a patient? I'm being facetious a little bit, but like we want our study club to be so low level, not low level as far as like it's low execution, but low level that anybody can ask any question without judgment.
Nice.
So our goal in our study club is that we place a lot of implants, like a pretty high volume, and we want to make sure that the patient gets the best outcome. And that requires coordination between us, the dentist, the lab, and a lot of components. And if anything's amiss, the whole thing can unwind after 3 or 4 or 5 years. And then hindsight's 2020 when we're like, oh, the abutment was the wrong abutment, or the lab made this the wrong shape, or the dentist didn't know the right torque value. So we just try to really make it really simple and anybody can ask any questions. And I sometimes ask the simplest questions because I don't know some stuff about general dentistry, and that helps bring everybody down to the same level. I might ask a question like, how do you guys adjust occlusion? Or what do something that maybe they would be like, oh, hey, I can help you with that. And I'm not adjusting much occlusion, but asking simple questions, if I feel vulnerable, makes them feel vulnerable and everybody feels very comfortable. So I would say the study club is really just helping people ask the simple questions that maybe they're scared to ask. Um, we definitely do interdisciplinary and more complex cases and those things, but our main purpose is to make the average dentist come in and feel super comfortable, maybe because they had a lack of experience or knowledge, but I just want them coming in and asking any question that they can and not feel judged about it.
That's awesome.
Very good. Very good.
Do you have any advice for oral surgeons looking to deepen their implant knowledge?
Any doctors who are doctors who are looking to deepen their implant knowledge.
Yeah, I think planning your own surgeries digitally helps a lot. I think, our practice, so generally it seems there's this division between a periodontist and an oral surgeon. There's always infighting and you do this, I do that. I think we should all learn off each other and help each other and do better outcome because ultimately the patient benefits. And it shouldn't be that, hey, you shouldn't be doing this kind of implant because it's too close to the nerve. You don't have the specialty, or vice versa. That hey, oral surgeons can't do cosmetic periodontology. I think we should help each other. So for an oral surgeon, I'll tell you, when I got a residency, I probably did one or two something called free gingival graft, which is architecturally trying to make plastic surgery of the gums, essentially. When I got out, I found my patient needed it. I did it, and I didn't charge them. And we still don't charge them because you become so good and fast at it. But the outcome is more important than generating revenue off of these adjunctive procedures. So in our practice, when I'm doing an implant, I'm doing the connective tissue graft or the soft tissue work. I'm often doing it for free. And not only does that benefit the patient, it makes it less costly. And then we gain a skill set and then our community develops awareness. I think that's probably the biggest thing I see with the oral surgeons that if they need some gum grafting that's kind of borderline, maybe they won't do it because they don't have comfort. But I think you have to push through that discomfort and maybe don't charge for it and then get the patient a good outcome, and then you can build upon that.
I wish you would have talked to the oral surgeon who did that work on me and did gum grafting, because he charged me.
I'm not saying it's not right charge, but I don't know. Very different.
It was perfectly pop. Perfectly
Yeah.
pop. Was it?
My staff is always telling me that, hey, I don't charge enough for certain things, but if something only takes me 5 or 10 minutes and the outcome is better, I don't think we need to nickel and dime over 5 or 10 minutes of work.
Yeah, exactly. Yeah, that's terrific. Well, we have, honestly, I don't remember, I distinctly remember meeting with you. Your wife was there in your conference room.
Oh yeah.
In Issaquah. And for those individuals who don't know where Issaquah is, it's a beautiful area right outside of Seattle. What, 30, 40 minutes from Seattle?
Yeah.
And yes, I distinctly remember being there, and we started a relationship with you, which has been a good one. We're very proud to be and privileged to be part of what you're doing there. And I don't say that to everybody, but it's true. I would like to ask you, and this kind of sounds like an infomercial. It's not, because I love to get this information from clients. How our company, how have we helped to support the growth and operations of the practice that you feel that kind of resonate with you?
Good question. I remember when we met, Alan, I was like very money focused, right? So I was like, do I really want to spend this extra thing for this extra thing? And I think that's thinking small, right? If you're really thinking small, then yeah, you're gonna be a surgeon with small volume, and you're gonna be working lots of hours and not gonna be wanting to practice that you like, and
Yeah.
just save a few dollars. And then you did the analysis of the office, and I was like, hey, this sounds intriguing. It's like maybe this is the wrong interpretation, but to me, it was more of a macro view. So the oral surgeons were micro view, looking at the small things, administering local, but macro view is like looking at the structure of your team, or the structure of the practice, or the structure of the schedule, which I'm guessing some oral surgeons are very good at. I wasn't. I had no understanding of any of that. And I remember, I think you said the words to me, right now, implants fill in the gaps in between your wisdom teeth. But you really should have a practice that your wisdom teeth are gap fillers and your implants are your primary. If you like that, right? And I liked implants. And it's totally accurate. That's where we are. Like wisdom teeth are just in between filling the schedule. But so what did we do? So I think the biggest thing that happened initially where I realized e-practice was like such a big help, COVID hit. So right when you'd think the expense of having this other company help you manage is like, oh, that's stressful. No, you guys came in, you're like, oh, here's what we should do. Let's look at your budget. Let's look at how much money do you have in the bank? What can we cut? Like I went with Wendy and we did like super complex Excel sheet, timed it all out, figured out how many months we had. And the stress level came down so much because we could just figure out, okay, we have this many months. The practice is not going to implode. We can pull from here, pulling levers like, Wendy's like, talk to your landlord, see what we can cut out from expenses there temporarily. And we did all that and it worked perfectly. And then everything opened back up. We didn't even need it. So that was early on the initial impact that probably was like the biggest eye-opening thing. And that's what the one thing I talk to people about, like when you're in crisis mode, they can help. There we had like, little HR crisis things that we had and terminating certain people, things that I thought were big and the hardest thing I could ever do. Like, how could I ever terminate this person who's been with me for so long? You guys made it so easy. They're just like, here's how you do it. And now when I look back, those huge things are small things because you guys trained me through it. Um, Structuring my schedule, I'd be like, um, Wendy, feel overwhelmed at the end of the day. She's like, okay, write down, what are you overwhelmed about? What do you have to do? I just wrote it out. And 6 months later, I don't even deal with those things anymore. Like, wow, we figured out how to push them out. The things that I thought I could never hand off or restructure in a way that I could execute on them, you guys helped me do that. Like, a letter used to be something I'd spend till 8 o'clock at night writing letters to all my referrals and doing all these things. And I'm like, no one can ever do it as good as me. No, I just thought that. Thought I couldn't train my team. And you guys taught me to modify templates, to modify how the letter's sent. And now my involvement in the letter is like, 5 minutes a day. And the letter's done better than I could have done it. And then the structure of the schedule, how I go from room to room and the gaps. It's just, you guys have blown my mind. I mean, we're probably 3 or 4x from where me and you started as far as our volume, and I'm not working more hours. And I'm happier and I'm doing more stuff. So yeah, you guys have been amazing. And now it's simple stuff. I'll just call you guys and be like, hey, I'm dealing with this thing. Can you help me figure it out? Because I want it this way. And you guys just help me shift it the way I want it. Not the way you guys want it, but what I want. And that's been the number one thing. You could just ask me what I want.
Excellent. Wow. Gee, this is one of the best podcasts I've ever heard. Well, I mean, talk about a softball self-serving question. I didn't intend it to be that, but it's just delightful. It's delightful to hear this. It really is, because it's clearly you're an individual who although you have a good business sense, you grasp things quickly, quite obviously. There's a sense of real care and real passion about what you do that I'm sure comes across to not only your patients but your staff. I know Wendy comments on it all the time. So, we have learned that it's never about us. It's about who are we there to help? Who are we there to, your value has to do with your ability to serve and service others. That's really what it's all about. I think it's a great message that we've learned. So I'm so happy to hear that.
Well, that's the purpose of your business, right? So your purpose, I find, is to help us. And as soon as you focused on that, you guys are successful.
Yeah.
You guys help me do the same thing, right? So it's like we get caught in the minutia of day to day of she said this and he said this and she's upset because he never got me this present, or just like total minutia.
Yeah.
You guys, help me revisit what was my purpose. Was it our patients and the practice? The practice is just. And every time we have any chaos in the office, we're just like, is that helping the practice or the patients? If not, it doesn't have any role here. And then we just help let's say the very motto you have for your practice is kind of what you put in practice, and it just keeps propagating. And then that turns into thousands of positive reviews and happy patients and good outcomes. It all just keeps feeding itself.
Yeah, it's great. It's a great point. And there's so much that's been written about purpose. How when things do get difficult, what gets us through it, really, even the most difficult times, is our purpose. Lots of books on the why and so forth. So I could not agree with you more. That's awesome. Well, along that line, to kind of sort of wrap this up, what sort of I'm interested in your thoughts for emerging dentists and professionals, and suggestions and any advice that you have. You must get asked about this every.
I think I do, and I don't think I know either. And maybe you guys will know better. Like, this whole DSO thing is, I think, challenging, and the corporate practice of practices being owned by corporate. I think it's I think it's gonna be challenging for the new group coming in. Like I'm lucky we built this from scratch and this office is wonderful. I can buy and do whatever I want. It doesn't really matter what things cost because I don't have to answer to a corporation. Um, but I think new surgeons coming out, I think it'll be hard for them to afford a practice coming straight out unless they know somebody or the availability may not be there. Um, I actually don't know what the new guys are going to do. I think it's going to be really difficult, and maybe at the end of my career it'll be difficult too because maybe my contracts won't be as good as the next guy. But truthfully, I lean on you guys for that. Like, I'm like, hey, my contract wasn't good. You're like, oh, this other vendor can help you do this contract and get a better rate, or hey, you can get a better purchase order through this group purchase organization. So you guys have definitely helped me because you guys deal with some of those corporations and you guys deal with bigger oral surgery practices, and then you guys help us execute and be successful. But I think that's probably the biggest challenge. It's just coming out and being in this fighting with these big entities, not fighting, trying to work with
Yes.
these big, just like how do you survive as the small guy with a smaller marketing budget and all the smaller things. It hasn't been hard for us, but I think I was lucky because we started in early. But I think coming out this year I think it'd be challenging over the next 5 years.
Yeah, I think it's a great point. Just to that point, we're starting a program, and we're going to be promoting it heavily to residencies around the country and to new doctors. It's going to be a 12-month comprehensive program on all of the basics, the business basics that, as you probably know and have observed, doctors do not get in their clinical education. They come out as clinicians. This is what they've devoted their lives and many years to, but they are short on these other skills, not because of lack of intelligence, but simply lack of exposure to where do you locate? How do you locate? How do you decide, do I go into a DSO or don't I go into a DSO? What are the differences? What are the costs? How do I bring aboard staff? And these issues are so fundamental to getting started properly. They'll either launch you on a good trajectory or a very, very slow one. So we're very sensitive to these new doctors. I'm interested. I like what you said about that. I think it is a true challenge.
I like that idea for the program because, when I was in fellowship, Dr. Jacob Hayabi told me surgery is easy, the business is difficult. And when you're in training, you can't do that. And I was like, I don't believe that. I was like, there's no way. I 100% agree now. Like, I wish I could just be in surgery because that part is just autonomous and
Yes.
you just get better at it. It's not really thinking. The business part is hard. So someone can teach you that business perspective or the macro view early on. The surgery, everybody, by the time you're 50, everybody's going to be, surgery's going to be like, just like you're going to turn your eyes off, you're just going to do it. But the business part, if you don't know that and you start learning it at 50 or 55, you're behind the curve. And now you're trying to like learn all that stuff. And maybe your practice is structured in such a way that's really hard to pivot because you're just so ingrained. So I think that's great. As long as you get the right person to be able to to hear that message, you have to be open-minded. But yeah, I think if you could just pass that message on to them, I think a 12-month program early on, it should be in residency really, but I think that's difficult. Should be.
Yeah, it should be. Yeah, we're working with some other large partners to promote to the institutions that they work with. And yeah, I agree with you. Well, the people who will do this, it's going to be a very low barrier to entry, very affordable, even by a resident or a student. And because we want to be able to give them enough of these fundamentals so that when they do start practice, they're not overwhelmed with things that have very, very simple answers that will make their lives much better. So, well, thank you for that. Thank you so much for doing this, Dr. Dhaliwal. Where can our listeners and people who want to connect further with you or contact you? Are you on social media? Are you
I am, but to be honest, I don't check it very often. So if you send a message, I often won't see it for 6 months. I get a lot of emails. So, my email, I'm open to have it's doctor@adarasurgical.com, but I probably get like 200 emails a day. So I don't always get to it. So if people are really trying to get a hold of me, the best is probably to contact the office and just talk to my front desk and be like, hey, I want to talk to Dr. Dhaliwal, and then they'll get it to me, or just keep emailing me multiple times and I'll get to the email. Unfortunately, that part is difficult for me, in which you guys are helping me structure and having people manage my inbox and so forth. So
good? Thank you. And the practice is Adara, Adari. It's Adara Surgical Institute.
yeah, ADARA Surgical Institute. Yeah.
Wonderful. Okay, great. Hey, this was terrific.
Great.
And,
It was nice.
and yeah, enjoy Maui. I'm so glad. You deserve the break. I'm so glad you're there with the family. One of my favorite places to go.
Thanks, Alan. Appreciate it. Thank you, Sarah. Appreciate you guys.
No, girl.
Okay.
Okay. Thank you so much. Take care, buddy.